People in Britain are less likely to survive treatable conditions such as breast cancer or strokes than those in other rich nations, a new study has found.
Yes, the review by the King's Fund linked the issue to below-average funding for the NHS, resulting in a lack of equipment and staff.
Now, this follows the Prime Minister's announcement of a 15-year plan to support the NHS workforce, saying he feels a great responsibility to ensure the health service survives.
Well, James Heale, political correspondent at The Spectator, joins us in the studio now to tell us more. Good morning to you, James. Really good to see you this morning. This doesn't make for good reading, does it? That essentially, if you live in the UK, you will find it much harder to survive things like breast cancer because of the state of our NHS. It's not good, is it?
Yeah, quite. So this is a major study of 19 different countries, and I think the headline figure which everyone will alight upon is the fact that the UK came 16th and 18th respectively for preventable and treatable causes of mortality. We know this is a long-term problem. As far back as 2014, there was a Commonwealth Fund study which showed that the UK, the major black market entity at UK NHS, was the fact that it struggled to keep people alive. So I know this is a long-term thing. It's worth pointing out, of course, that the report does talk about other factors, of course, quality of life in the UK, things to do with eating and sort of exercise, etc. But it is not good news. I mean, there's some bits of it which highlights the fact that the UK is very good at approving medicine quickly, but it's all put more pressure on Rishi Sunak ahead of the release of the NHS Workforce Plan on Thursday, and also, crucially, ahead of that 75th anniversary of the NHS next month.
So are we having different policy statements every day this week on the NHS? Those are going to be one big day with one big announcement.
It's going to be brought on Thursday. That's when it's all scheduled to be. But I imagine we'll see drip-fed stories throughout the next few days. Already we've seen Rishi Sunak reportedly considering plans to introduce medical schools in those areas which are really suffering from care, a lack of care. That 1 in 10 vacancies in the NHS workforce at the present, but of course that doesn't fall evenly across the country. So there are some areas which are suffering from a lack of force more than others.
But James, how is he going to recruit, say, doctors? It's 3 years to train a nurse, 5-7 years to train a doctor. With the junior doctor strike that continues, that goes on, how could you then attract young people to say, this is a good career, this would be a good career choice for you?
Yeah, it's going to completely struggle to do that, particularly at the side of an election, because, as you say, there's longer-term issues facing it. So they're considering a range of different ways in which you can kind of, you can't look at, for instance, salary, because there isn't much money available in the system. So they're trying to look at ways to ease the burden, looking at things like bringing in new technology, etc. But you're right, it's going to be a real problem for Rishi Sunak to see any major sort of sign of this ahead of the next election. They want to do things like having sort of pharmacies considering ways to give out care, etc., in order to put the burden within the system on other bits of it. But it's going to be a real problem, and that's why we're going to see Labour leading on the attack on this.
I mean, we are hearing, as part of this 15-year workforce plan from Rishi Sunak, that he's going to talk about a doctor's apprenticeship, so people leave school and essentially learn to be a doctor on the job, on a hospital floor. What do you make of that? Do you think that could be the way forward? I
mean, there's certainly strong potential to look at what other countries are doing, and I hope that the benefit of this report, which obviously does consider 19 different systems, as we do look at other countries who do similar things in this. But I think it's obviously going to be very difficult, given people's concerns about the lack of care, etc., whether these are going to be fully qualified to do this.
But there's got to be a different way of doing things and looking at things and revamping the system. I mean, I think there should be apprenticeships for dentists, there should be apprenticeships for nurses, there should be apprenticeships for doctors. It's not to say that there should be any less well-trained at all of this. We should just make it easier for people to be these professionals. I mean, when I was young, if I had been smart enough, I would have been a doctor.
Would you?
Yeah.
Are you good with gore?
No, but I'm nice in a white coat and a stethoscope, sort of looks the part, But you're not allowed to wear those nowadays. But I don't know, I would have aspired to being a doctor, but I know I couldn't have done it. And that's why I stand back and scratch my head and go, why aren't these people lauded? Why aren't they praised? Why aren't they valued within our society?
I think you're quite right, and I think it's really telling that ahead of next month's 75th anniversary of the NHS, it's much more low-key, the celebration around it, compared to 5 years ago. And I think that's because people know that this quality has worsened, and that for all the kind of praise within the COVID crisis, frankly, the cost of living pressures on doctors has got a lot worse, and that's why we're seeing people go abroad, and there's high numbers of vacancies within the NHS system.
I mean, a lot of it as well is to do with the waiting list, isn't it? I mean, 7.8 million people are waiting for care in the NHS in England. I mean, the government would say a lot of that is down to COVID, and it's a COVID backlog. How much do you think that's true, or do you think it's to do with the funding model, and quite frankly, it's not working.
Yeah, I mean, I think what's always worth instructive now is because of devolution, we've now got an NHS in England, Wales, Scotland, Northern Ireland, all with different governments in control of that. And over the weekend, I was reading some of the Scottish press, which shows that in Scotland it's even worse than England. So I don't think it's necessarily to do with the party in control, but it is going to be about the system which is underpinning all of this. And one would hope that often this debate comes down to, are we going to have Britain or America? Well, actually, there's a whole variety of different systems. As you can see from this report out today, other sister countries in Europe, for instance, do things differently. So are there ways in which you can learn from it? The key thing is I don't think anything's going to be done this time of an election. Wes Streeting on Labour's side has been talking a very good game about this, but I wonder if actually he's going to be able to take on the unions with his own party and deliver something that works for consumers and patients.
James, so much to talk to you about today. We're going to have you back later in the show, but the Putin situation and the Wagner coup, does that wet your lips in any way?
Yeah, I think what was really telling is how keen our government is to stay out of the whole thing in the sense of this is a Russian internal matter. We're not going to get involved picking one side or the other. I do think what's really telling is that unlike last February, when there was the invasion that happened, the UK and the USA declassified all the intelligence to stop Putin getting a pretext of lies. They didn't do that this time. They knew as soon as last Wednesday that there was going to be some kind of coup, mutiny, etc., and they didn't declassify that, and that was really telling, I think.
OK. Back after 7. Let's talk some more. Thank you very much. Thank you very much indeed. That's James Heale. James, the political correspondent for The Spectator.